The alarm didn't sound like the others. Every nurse on the floor of Mercy General Hospital knew the difference between a routine monitor alert and the kind of alarm that meant someone was running out of time. This one, sharp, relentless, cutting through the sterile air of the ICU like a blade, was the second kind. It was 2:47 in the morning. The hallway was dim, the kind of dim that makes everything feel underwater. And in that underwater silence, one figure was already moving. She didn't run. That was the first thing people noticed later, when they replayed the security footage. Everyone else ran. The orderlies jogged. The on-call resident sprinted from the break room with a coffee stain on his scrubs. Even the charge nurse moved at a near sprint, her shoes squeaking against the polished floor. But the woman in Bay 7's doorway? She walked. Fast, precise, deliberate, but she walked. Like someone who had been inside chaos so many times that panic had simply stopped being an option. Her name was Sergeant. No, wait. Her name was Maya Reeves. That's what her badge said. Maya Reeves, RN, ICU. That's who she was here. That's who she was supposed to be. The patient in Bay 7 was a 63-year-old veteran named Harold Sims. He had been admitted 4 days ago with a pulmonary embolism. He was stable, monitoring, supposed to be fine. He was not fine. His oxygen saturation had dropped to 71%. His lips were the color of a bruise. His chest was heaving in that horrible, mechanical way, the body doing math it can't solve, trying to breathe through a wall. Maya Reeves stepped to his bedside. She placed 2 fingers on his wrist. Not because she needed to. The monitor was right there. She did it because she needed to. Because she trusted her hands more than she trusted machines. She always had. Mr. Sims. Her voice was low level. A voice designed for this exact room. I need you to look at me. His eyes were glassy. Drifting. Harold. Firmer now. Eyes on me. He found her. And something in his face changed. Not relief, not yet. But recognition. The way a drowning man recognizes a rope. She was already reaching for the emergency supply cart when the attending physician burst through the door. Dr. Elliot Marsh, 44, Harvard Med. The kind of doctor whose confidence enters the room 3 seconds before he does. He stopped when he saw her. Not because of the patient. Because of her. Reeves. His voice was flat. Step back. She didn't move. I said step back. You're not authorized to. His left lung is compromised. She didn't look up. Tension pneumothorax. Secondary to the embolism. We have maybe 90 seconds before. I will handle this. He moved toward her. Physically moved toward her, invading her space the way powerful men sometimes do when a woman refuses to shrink. You're a floor nurse. You don't diagnose. You don't. The monitor screamed. Harold Sims flatlined. And in the terrible silence that followed, that 1/2 second of pure stillness before the crash cart was called and bodies started colliding in urgent choreography, Maya Reeves looked at Dr. Marsh with an expression that wasn't anger. It was something quieter than anger. It was patience. The dangerous kind. Because she had seen this before. Not in this hospital. Not in these fluorescent lights and this antiseptic air. She had seen the moment when authority and arrogance collide with the reality that someone is dying, and she had learned, in places far darker than this hallway, exactly what to do when that happened. But you don't know who she is yet. Neither did they. Maya Reeves had been working at Mercy General for 11 months. She had appeared, as most traveling nurses do, with a resume that was technically complete and personally opaque. Her references checked out. Her certifications were flawless. Her clinical scores during orientation were, and this is a direct quote from the nursing supervisor who evaluated her, almost unsettling. She had rented a small apartment 12 minutes from the hospital. Ground floor. One exit at the front, one at the back. Neighbors would later say she was polite, quiet, and occasionally arrived home at strange hours in clothes that smelled like antiseptic and something else they couldn't name. She kept a running schedule. Every morning at 5:15, regardless of her shift. Rain, cold, the kind of February wind that makes grown men reconsider everything, she ran. 5 miles. Always the same route. Always the same pace. Always with a focus that made other joggers move to the side of the path without quite knowing why. She cooked her own meals. She owned exactly 4 personal photographs, all framed, all placed with a precision that suggested deliberate thought. In one of them, she was younger, 25, maybe, in a group of 8 people in tactical gear, somewhere that was clearly not America. She was smiling in it. The kind of smile you only smile when you've survived something. Her colleagues liked her, mostly. She was good at her job in the way that slightly intimidates people who are merely competent at theirs. She never made a fuss. She never complained about the schedule. She picked up overnight shifts the way some people pick up an extra coffee, as if the inconvenience didn't register. There were small things, though. The other nurses noticed them one by one, and then collectively filed them in that mental folder labeled, "She's just a little different." There was the time a patient went into anaphylactic shock in the hallway. Code blue, full panic, everyone moving in every direction at once. And Maya was the first one to the patient by a margin that made no physical sense given where she'd been standing. She had moved through that chaos like water through a cracked door. Not fast. Efficient. Every movement accounted for. Nothing wasted. There was the time a violent, disoriented patient, a large man coming off a procedure, confused, strong, grabbed a male orderly by the collar and lifted him. 3 people froze. 2 backed up. Maya said quietly, "Hey." Just that. 1 syllable. The patient looked at her. She held eye contact for 4 seconds. He let go. She helped him back to bed, talking softly the entire time. And when she left the room, the orderly asked her what she'd done, and she said, "Nothing. He just needed someone to be calm." Then there was the medication cart incident. A young nurse named Priya had made an error, not catastrophic, but serious. She'd pulled the wrong dosage from a cabinet. Maya had noticed it from across the room. She hadn't made a scene. She'd walked over, placed her hand on Priya's arm, and quietly redirected her. Later, in the break room, someone asked Maya how she'd spotted it from that distance. She said, "I'm always watching." She said it so naturally, so without drama, that it took 2 full seconds for everyone in the room to realize how strange it was. Always watching. Who talks like that? And then there were the nights when the security guard, an older man named Thomas who did the 11 p.m. to 7 a.m. rounds, would see her sitting alone in the family consultation room during her break. Not on her phone, not reading, just sitting, very still, in a posture that was too perfectly controlled to be called relaxation. He asked her once if she was okay. She said, "Just resetting." Resetting. He didn't ask again. What nobody at Mercy General knew, what her badge and her paperwork and her pleasant, professional demeanor had carefully, deliberately never revealed, was that before she was Maya Reeves, RN, ICU, she had spent 9 years as something else entirely. Something that explained the posture, the scanning eyes, the calmness in catastrophe, the way she moved through chaos like it was familiar territory. Because for her it was. But that revelation belongs later. Because first, you need to understand what happened to her in this hospital, what they did, and why, when the truth finally came out, it hit everyone in that building like a freight train they never saw coming. Mercy General was not a bad hospital. It was, by most metrics, a very good one. Level 2 trauma center, 800 beds, a cardiology wing that had been featured in a regional magazine 3 years running, a research partnership with the state university, the kind of institution that had enough prestige to make its flaws feel invisible, until those flaws were standing directly in front of you in a hallway at 3 a.m. The ICU was its own ecosystem. 15 beds. A charge nurse named Director Sandra Hollis, who had been managing that floor for 17 years and had developed, over those 17 years, a set of rules, procedures, and hierarchies so entrenched that questioning them felt not just professionally risky, but somehow morally wrong. Sandra was not a cruel woman. She was an institutional woman. She believed in process the way some people believe in religion, not because she'd tested it, but because it had always been there. And then there was Dr. Elliot Marsh. If Sandra was the religion, Marsh was its high priest. He was the kind of physician who had been brilliant once, genuinely, impressively brilliant, and had confused that early brilliance with a permanent state of being. He quoted studies from 2014 and 2024 with the authority of someone who had just read them. He interrupted nurses mid-sentence. He documented his own correct decisions with the enthusiasm of a man building a personal monument. He had never, in 17 years, been seriously wrong on the floor. He had also never been seriously challenged. Not until Maya. It started small. 3 weeks into Maya's time on the unit, she flagged a patient for early sepsis, 6 hours before the standard protocol would have triggered an alert. She mentioned it during rounds, quietly, referencing 3 clinical indicators that, individually, were minor, but together formed a pattern she recognized. Marsh dismissed it. "The markers don't meet threshold," he said, without looking up from the chart. "I know they don't," Maya said. "But I think. If you think something is wrong, file an incident report." He handed the chart to his resident. "That's what the process is for." She filed the report. 6 hours later, the patient crashed into septic shock. He survived, barely. And the ICU team moved fast and professionally and correctly, and afterward, in the debrief, nobody mentioned Maya's early flag. Nobody revisited the incident report. Nobody said the words, "She was right 6 hours ago." Marsh certainly didn't. But Sandra noticed. And Sandra's reaction was not gratitude. Sandra's reaction was a particular kind of institutional defensiveness that manifests as suspicion. If the nurse had been right, it meant the process had been inadequate. If the process had been inadequate, it reflected on the people who maintained it. Therefore, and this logic, while absurd, is surprisingly common in hierarchical institutions, the nurse was the problem. She called Maya into her office. "You need to trust the system," Sandra said, folding her hands on the desk in the way people do when they want to look calm and feel in control. "We have protocols for a reason." "I understand that," Maya said. "Our physicians are some of the best in the state." "I know. So when Dr. Marsh makes a clinical call, your job is to support that call, not undermine it." Maya looked at her for a long moment. "A patient almost died. A patient was treated," Sandra said, "within the parameters of established. 6 hours late." Silence. "You're new here," Sandra finally said. The words weren't a threat. They were a reminder. "You don't have standing. You don't have history. You don't have the weight of this place behind you. I'd encourage you to remember that." Maya nodded, said nothing else, left the office. In the break room, the other nurses had seen her go in and watched her come out. Priya caught her eye, asked silently if she was okay with a small tilt of her head. Maya made coffee. "Fine," she said. She wasn't bothered, not in the way they expected. But something had shifted in the architecture of that floor, some invisible load-bearing wall between Maya and the institution that housed her, and cracks were forming in it that nobody could see yet. Over the next several weeks, the incidents accumulated. Maya questioned a drug interaction that Marsh had approved. She was wrong, technically, pharmacologically, on paper. But she'd raised it because the patient was also taking an herbal supplement that hadn't made it into the chart, and that combination, Maya caught it. Another near miss quietly absorbed into the background noise of the institution. She requested different positioning for a ventilated patient, a small mechanical adjustment, something she said she'd seen work before in other contexts. The resident asked what contexts. Maya paused half a second too long before saying previous facilities. He reported it to Marsh. Marsh reported it to Sandra. And Sandra called Maya into her office a second time. This meeting was different. "There have been concerns raised," Sandra said, "about your clinical behavior. Your apparent tendency to second-guess attending decisions, to operate outside your scope." Maya waited. "I'm placing a note in your file. And until further review, you will not be assigned to the ICU." Maya looked at her. "You're removing me from the unit. I'm reassigning you to. I'm the most experienced nurse on this floor." The words were quiet, not angry, just precise. "That's a matter of opinion," Sandra said. Maya stood up. "Okay." She walked out. And that quiet walk out of an office, that unremarkable exit, should have been the end of it. The institution had spoken. The hierarchy had reasserted itself. The machine had processed an irregular element and expelled it. Except for what came through the front doors of Mercy General, 3 days later, on a Tuesday morning. The dog arrived first. That's how everyone remembered it later. Not the man beside it, not the 2 officers flanking them, the dog. A Belgian Malinois, 90 pounds of lean, alert, muscle, and intelligence, wearing a working vest that was faded and patched in 2 places. His name, as the ID tag on his vest identified, was Ranger. He was accompanying his handler, a retired Army officer named Captain Dennis Werrell, who had been admitted for emergency cardiac observation after collapsing at a Veterans Affairs event 2 miles away. Protocol allowed certified therapy and service animals. Ranger qualified, decorated, certified, retired from active duty just like his handler. But Ranger was not behaving like a therapy dog. He was alert in the way working dogs are alert. Head up, scanning, compartmentalizing. He cataloged the room in the way trained animals catalog rooms. Exits. People. He was fine until they reached the 4th floor. The moment the elevator doors opened onto the ICU hallway, Ranger stopped. Not sat. Not paused. Stopped. Weight back. Hackles a fraction elevated. Nose working the air with that precise, rapid efficiency that made the orderly nearest to him take an instinctive step backward. Captain Werrell tugged the leash gently. "Come on, boy." Ranger didn't move. He was staring down the hallway. It happened at 2:44 in the morning, 3 minutes before the alarm. Maya was awake. She had been sitting with the stillness of someone who had learned to be still in places where stillness was survival. Not sleeping, not scrolling, not drifting, simply waiting with her entire nervous system tuned to a frequency that most people can't access and fewer can sustain. She heard it before the monitor registered it. Not the sound of the alarm, the sound of the room changing. The shift in the quality of the air that comes when a body in crisis begins its final negotiation with mortality. She had heard that sound in tents, in field hospitals, in aircraft that were losing altitude, and she heard it now, through a wall in a corridor. In a hospital she was technically banned from treating patients in. She was moving before she was thinking. Down the hallway, past the nurse's station, into the ICU. The monitor in Bay 7 was just beginning its scream when she reached Harold Sims' door. This is where we came in. This is where Dr. Marsh appeared behind her and told her to step back. This is where the flatline happened. This is where the universe handed Mercy General Hospital a moment that would define everyone in it. The crash cart arrived in 40 seconds. Standard response. Good time. Actually, the night team was experienced and trained, and the machine of emergency medicine engaged the way it was supposed to. But the machine was not solving the right problem. Marsh called the event as cardiac, a reasonable assumption, statistically likely, protocol appropriate. Defibrillation prep began. The resident was preparing medications. The respiratory therapist was adjusting the ventilator settings. Maya was watching from the doorway. She had been physically moved there by a male nurse who had followed Marsh's instruction to get her out of the way. She hadn't fought it. She was watching. She was watching Sim's chest. The left side wasn't rising the same way as the right. It was subtle, the kind of thing you'd miss if you weren't specifically looking for it, the kind of thing that requires a clinical eye calibrated by experience that went far beyond standard nursing school, that required having stood over bodies in conditions where a missed detail cost a life. She spoke from the doorway. It's not cardiac. Nobody turned around. Marsh. Her voice was louder now, not panicked, calibrated to cut through the noise. Stop. It's not cardiac. Someone get her out of here, Marsh said. His left chest wall isn't moving symmetrically. It's a tension pneumo, secondary to the embolism, just like I told you an hour ago. If you shock him, you will kill him. Marsh paused, one fraction of a second. Then, prepare to charge. Stop. The word detonated in the room. Not because it was loud, though it was. Because of how it was delivered, the way it landed. With an authority that had nothing to do with title or credential or hospital hierarchy. With the kind of command presence that stops trained professionals mid-action because their bodies recognize it before their brains do. Everyone froze. Even Marsh. In the doorway, Maya Reeves stood with her feet shoulder-width apart, her hands at her sides, her face absolutely composed, and she looked at Dr. Elliot Marsh with 9 years of a life he knew nothing about behind her eyes. Needle decompression, she said. Second intercostal space. Mid-clavicular line. Left side. Right now. Silence. 2 seconds. 5. The monitor was still screaming. Harold Sims had 60 seconds of viable resuscitation window left. She's wrong, Marsh said. But his voice had changed. Some essential frequency of certainty had shifted in it. Prep the. I am not wrong. She moved into the room. Nobody stopped her. She moved to the supply cart, pulled the needle with practiced precision, and turned to face Marsh. You can document this however you want afterward. You can report me tonight, tomorrow, to the board, to God. I don't care. But this man is going to die in the next 45 seconds if you put electricity through him, and I am not going to watch that happen. Marsh stared at her. She held the needle. The room held its breath. The second hand moved. And then something happened that nobody in that room had ever seen Dr. Elliot Marsh do. He stepped back. He stepped back and he said quietly, "Do it." Maya moved. The needle found the exact location with a precision that made the resident visibly exhale. Not a guess, not an approximation, but the muscle memory accuracy of someone who had performed this procedure in conditions that made a sterile ICU look like a controlled simulation. The hiss of escaping air was audible. The monitor changed immediately. Not flatline to normal. Nothing works that cleanly. But the catastrophic pressure that had been crushing Harold Sims' heart began to release, and his oxygen saturation, which had been at 0, began its slow climb back toward the territory of the living. It hit 40. 50. The team moved around Maya with the coordinated efficiency that comes after the correct diagnosis, the right problem now being attacked by the right tools. Chest tube prep. Medication adjustment. The respiratory therapist finding new parameters. 62. 70. Priya, who had arrived in the commotion of the alarm, was standing at the nurse's station. She was not performing any clinical function. She was simply watching Maya Reeves work, watching the economy of her movements, the absence of uncertainty, the way she communicated with the team in precise, minimal language that contained no waste, no hesitation, no performance. Like someone who had done this so many times that efficiency was automatic. Where did you learn this? The thought appeared in Priya's mind fully formed. What are you? Harold Sim's saturation hit 81. He coughed. A wet, ragged, beautiful sound. His eyes opened. They found Maya. She was standing at his side, and she was looking at him with an expression that Priya would later describe, searching for the right word for 20 minutes, as relief that was too old for this moment. Like she had been carrying the weight of something that looked exactly like this for a very long time, and it had finally, in this room, in this fluorescent light, at 3:11 in the morning, been set down. You're okay, Maya told him. Her voice was perfectly steady. Only her hands, just barely, just for a moment, were not. Captain Dennis Werrell had not slept. He had been in cardiac observation in room 412, 20 feet from the ICU, and he had heard everything through the institutional walls that were thinner than the hospital's reputation. He had heard the alarms. He had heard the voices. He had heard, with the trained ear of a man who had spent 2 decades in situations that required distinguishing important sounds from noise, a woman's voice delivering commands with a specific cadence that he recognized the way you recognize an accent from your hometown. He pressed the call button at 3:15. I need to see the woman who was in the ICU tonight, he told the overnight nurse. The one they said was banned from the floor. Sir, that's really not something I can. Her name is Reeves, he said. Maya Reeves. Tell her Dennis Werrell wants to talk. Pause. How do you know her name? Because, Captain Werrell said carefully, I don't think that's her name. Maya came. She sat in the chair beside his bed, and Ranger, still with his handler, authorized by the overnight administrator who had decided that arguing with a cardiac patient about his service dog was a fight not worth having, lifted his head from the floor and placed it on Maya's knee without being asked. She put her hand on his head automatically. You were 75th Ranger Regiment, Werrell said. It wasn't a question. She didn't answer. The way you moved in there, he continued. The needle decompression, that's not something you learn in a hospital. That's something you learn in a field, under pressure, with people shooting at you. He studied her. How many tours? The silence lasted long enough that he thought she wasn't going to answer. 3, she said finally. Afghanistan. Afghanistan. And one other place that doesn't get named in polite conversation. He nodded slowly. He knew the kind of place she meant. What was your role? She looked at him. Something in her face that had been carefully maintained, that pleasant, professional composure, shifted slightly, the way a theatrical mask shifts when the actor forgets, just for a moment, that they're still wearing it. Combat medic, she said. Then special operations combat medic. Then, she paused. Then something with a longer title and a smaller paper trail. Werrell absorbed this. And you're here because I needed somewhere to be, she said. Quietly. After. The full story emerged in pieces over the following 48 hours. Not because Maya told it. She didn't. Not voluntarily, but because Captain Werrell made phone calls. Because a man with his rank and his connections, who owed something to a woman who had helped keep a veteran alive at 3 a.m., could open doors that her carefully constructed civilian identity had closed. What those phone calls confirmed was this. Maya Reeves, her real name, as it turned out, though she'd built a wall around the history behind it, had served 9 years as an Army Special Operations combat medic, attached to units whose operational details remained classified. She had 3 tours. She had multiple commendations. She had, in the field, performed procedures that most physicians with 20 years of experience had never attempted. Emergency thoracotomies, battlefield amputations, tension pneumothorax decompressions, often in conditions that made every ICU in America look like a luxury spa. She had left the military not because she'd failed, but because she'd succeeded in a way that cost something irreplaceable. On her 3rd tour, she had been the only medic available when a convoy was hit. She had treated 6 people simultaneously in 40 minutes of active fire. 5 of them survived. 1 didn't. He was 19 years old. His name was Private First Class Jerome Werrell, Captain Dennis Werrell's nephew. She had kept him alive for 37 minutes. She had not been fast enough by 3. She had spent the 18 months after her discharge believing that was a math problem with a permanent answer, and she had come to Mercy General, to nursing, to the quiet institutional rhythm of shifts and protocols and badge numbers, because she needed to be somewhere she could still save people without carrying a weapon, without carrying the weight of that math. Dr. Marsh found out the way powerful people usually find out things that make them reckon with themselves, publicly, and with an audience. Captain Werrell had requested a meeting with hospital administration. He had brought documentation. He had also, because he was the kind of man who understood that some moments require precision and some require force, brought a framed photograph. It showed Maya in uniform, full dress uniform, with her decorations. There were a great many decorations. He placed it on the administrator's conference room table. The woman you suspended from the ICU, he said, holds a combat medical badge, a bronze star with Valor device, and a commendation for performing emergency field surgery under active fire that saved 5 lives in a single engagement. He looked around the table. She has probably forgotten more about emergency medicine than most of your attending physicians have learned. The administrator looked at the photograph for a long time. Then she looked at Sandra Hollis. Then at Dr. Elliot Marsh. Marsh was looking at the photograph. His face was doing something complicated. Harold Sims was moved out of the ICU on day 7. Before he was transferred, he asked to see the nurse who had been in his room that night. The one who'd told him to look at her. The one with the voice that had reached him through the dark. They brought Maya in. He was sitting up, color in his face. His hands, which had been the color of ash when she'd first taken his wrist, were pink and warm. They told me what you did, he said. The whole team. They told me what you did. He wasn't letting her deflect. He had the directness of an old soldier who had decided he was done with polite evasion. You were banned from this floor. You came anyway. She didn't answer. I'm 73 years, he said. I've got a daughter in Portland who's having her first baby in April, and I'm going to be there. His voice was careful and steady. Because of you. She nodded once. She was not going to cry. She had a record of not crying in rooms where crying was the reasonable response, and she maintained it now. But she took his hand, just for a moment. And in that grip, in the warm, bilateral pressure of a patient who was alive, something she had been carrying for 9 years, some internal accounting that had never quite balanced, shifted by one entry. Not erased. Shifted. She was reinstated to the ICU the following week. Marsh passed her in the hallway on her first morning back. He stopped. She stopped. What he said was, "Your assessment was correct." That was all. But for Elliot Marsh, who had spent 17 years being the most certain person in any room he entered, it was everything. She nodded, walked past him, took her position at the nurse's station like she had never left. Priya appeared at her elbow. How does it feel? Maya looked at the board, at the bay numbers, at the quiet, early morning stillness of the unit she had been fighting for without anyone knowing why. Like work, she said, and smiled. Ranger visited twice more before Captain Werrell was discharged. Both times, he went straight to Maya. Both times, she crouched down, put her hands on his face, and spoke to him quietly in a tone that nobody else could hear. Those who watched it said it didn't look like a woman greeting a dog. It looked like two veterans recognizing each other. Maybe that's what it was. Because some of the people who carry the most, who have seen the worst, who have given the most, don't look like heroes when you meet them. They look like your nurse. They look like the quiet woman who takes your wrist in the dark and tells you to look at her. They look like someone unremarkable until the moment arrives that requires them to be exactly what they are. And what they are is extraordinary. Maya Reeves went back to work. She picked up night shifts. She watched. She waited. She saved lives that never made the news, in a building that almost lost her, for patients who never knew how lucky they were. Some people spend a lifetime running from who they are. She spent a year before she found a place that finally deserved her.
Think about a person in your life who showed up quietly without fanfare and changed everything. You probably don't know what they did survive to get there. Drop their name in comments or just say I know Maya. Someone will understand.